John. He runs 3 times a week and is now in training for a marathon. John is the picture of health. 10 years ago, it was another story. Following a routine physical exam, John was told his cholesterol levels were dangerously high.
Subsequently, you do lots of reading up on the subject to understand what cholesterol is all about. So, having done that, now you can realize that there's a heightened chance of heart attack and maybe potentially other conditions as well.
In 2009, 2 in 5 Canadians reported they had at least one of 7 common chronic conditions. And every year, the number of chronic cases increases. Dr. Michael Evans is a family physician and an associate professor of family medicine and public health at the University of Toronto.
The face of illness has changed a bit, and much of my job as a family doctor is really what we call chronic disease management. So we have people with arthritis, diabetes, coronary artery disease. Often things like HIV and cancers have become not killers, but actually kind of a chronic disease. So much of my job is making sure that these people are self-managing their health. There's often lifestyle changes to make and helping them with that.
Drugs are often the first line of defense when treating chronic conditions. Prescriptions filled at local pharmacies nearly doubled between 1999 and 2009, from 272 million to 483 million. And every year, doctors prescribe more and more. The drug landscape is changing.
So let's take high blood pressure as an example. 10 years ago, I would have put you on one medication and crank the dose of that medication. Now, and this has played itself out in most chronic diseases, we've sort of discovered that it's kind of multiple low doses of different medications actually are much more effective. So it's a challenge for me, it's a challenge for the patient, it's a challenge for our system, but a big challenge is obviously burdening the cost of all that and trying to figure out what's cost effective.
Claude Destasio understands these challenges. She is the Vice President of Quebec Affairs for the Canadian Life and Health Insurance Association, the CLHIA, the non-profit trade association that represents life and health insurers.
People are becoming aware that the sustainability of the work plans that we said would be in danger, we're getting there. And that's why I may say again that the Canadian Life and Health Insurance Association has introduced that joint effort between insurance company in Canada to provide the pooling of risk, which everybody shares into the catastrophic drug, but that's one element.
To lower his cholesterol, John was prescribed Lipitor. At the time, it was the popular choice. John had a health benefit plan, but it only covered part of the drug's cost.
Yeah, I was buying it every month, and I was like, I remember it was like $140 every month that I had to pay for it, I think.
Hey, we don't have money to pay for all this. We have to be much smarter. I think we have to get people beyond doctors and nurses and the healthcare world to kind of be part of this, and that includes patients. And I think we have to kind of rethink how can we inspire innovation at the same time, cover the cost for the most amount of people and basically deliver the most effective care for the money.
Now John begins his day with yoga. Thanks to changes in his diet and exercise routine, he's lost 30 pounds. And for the past 3 years, he has been living without expensive medications. He's hoping to keep it that way.
We need to think in terms of productivity, pay sustainability of group plans and employers. And if the employers is no longer there, not just that person doesn't have access, but all other employees do not have access. We have to be careful. So I'm positive that we'll work out some solution, but the storm is coming. So we have to get ready.